Dr. Chris here at the Nerve Health Institute, and I understand you're suffering with some type of TMJ problem, and maybe you've had it for a little bit of time, maybe a long amount of time. TMJ can be very, very complicated. It also can be very easy, and so from our standpoint here at the Nerve Health Institute, we focus on on one of the main things we focus on is your brain here. So this is your power company in your body. That's the way you want to think about it. And remember, it's wired to 30 trillion cells. 30 trillion of these are in your body, which is crazy to think about. And so your brain, your whole life, is trying to maintain power to 30 trillion cells in your body. It's an impossible task. There's too much interference. And you probably heard a decent amount if you watch some of our other videos. But let's go dive deeper into TMJ. So back here, you have the most important nerves in your body, and they're called cranial nerves. And one of the cranial nerves is cranial nerve 5. It's called the trigeminal nerve. So the trigeminal nerve starts back here, and it goes around to all the musculature, just about all the musculature in your jaw. It also goes to many of your teeth. And so that particular nerve can be heavily involved in problems with TMJ when it loses the power from the brain. So I want you to think of energy flow. I always try to explain this to people. You won't see the flow of energy with an MRI. You can see the nerve, but you can't see the flow of energy through it. And you won't see it with an ultrasound. You won't see it with digital x-rays of the jaw. You won't see it with any of those things. But this is a reality. Every little cell present in your jaw, which I don't know the exact number of cells here, but I'm just going to guess it's probably in the millions or billions in this area, just throughout your body. Because remember, you have 30 trillion throughout your body. So just all those cells here, every single one of them is wired to the brain. And so just one component of TMJ that we see is just restoring the brain's connection to all the cells here. That helps people so much with this condition. We also have other methods, and I want you to think about this. Really, any nerve in the body, so your jaw is so active. I mean, how many times have I opened and closed my mouth just in this video? But imagine throughout your day, just walking around, it's bouncing, right? I mean, there's so many, your jaw is very, very active throughout the day. It's also extremely powerful, right? When you're chewing your food, we kind of take it for granted how powerful our jaw is. And then some patients who have TMJ get to where they can't. And so it could be very problematic, but I just want to make sure you understand how involved your TMJ is with all the components of your body. So a weakness up here can actually cause many weaknesses somewhere else. And so when we look at people with TMJ, we're going to look at your whole body and try to figure out, obviously, where it's disconnected, get you relief, make you feel better. But we also want to make sure we take a look and see that is this affecting anything here, here, or anywhere else throughout your body. A little side note too. One of the primary nerves that goes to your jaw also goes to your heart. And so remember, every part of your body's wired to your brain. So oftentimes we see people that have a lot of jaw issues that have these heart issues they're not aware of, and they're disconnects from the brain to the heart. And basically, if you don't get those taken care of, then it'll start popping up on cardiology tests, and then you get more and more problems. So if you have any issues like that, I would highly suggest getting here to get checked out, and we just do our best to help you.